If you're experiencing numbness and tingling into the arm, or a pain into the arm, or the shoulder blade, or the bottom of the neck, that pain and discomfort might be coming from the discs of the neck or the cervical spine. My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley. And today I'm going to talk all about cervical disc herniations, what they are, what it might feel like, and what we can do about it. Now let's look at the cervical spine or the neck. So this part of the spine is made up of 7 vertebrae stacked on top of each other. And in between is a disc. It acts as a spacer or a shock absorber. And with a sudden injury, or maybe over time, some stress through that area, little tears can develop in that disc. And then it can start to bulge out a little bit. Now you can see that the nerves exit out from the spinal cord, and they're very close to that disc. Now these nerves go out to the muscles of the arm, they go to sensation of the skin, and even some of the organs. Now, if this disc is started to bulging into the space where that nerve is, it can cause numbness and tingling, pain, and it can cause a lot of discomfort in your life. Now, when we move forward, the disc tends to bulge backwards. So if you already have a bulging disc, that forward neck position is really going to make those symptoms worse. So how do we know if we're suffering from this? Now, the definitive way, of course, is imaging, either CT scan or MRI. But if we can't have that quickly, then we can tell a lot off of your symptoms. So if you're having numbness and tingling in specific patterns in your hand, if you're having a deep ache into the arm, if there's a weakness in the arm. And in my clinical experience, often if you have that spot in your shoulder blade, it just never goes away. You might get treatment or you might do exercises, but it keeps returning and it's really nagging. That can actually be a sign of a nerve root irritation, sometimes coming from the disc bulging. Now, what can we do about it? The biggest thing we want to do when we're having nerve irritation is to calm the nervous system down. And so this can start with some postural changes for you. So as I mentioned, when you're in that sustained neck position, like you might be with on your phone or your iPad, that can cause that disc to move backwards. So we want to make sure we're avoiding any of that head down position. You want to make sure that your computer and your car are set up in a position where you're not sitting with your head forward like that. That puts a lot of strain on the bottom of the neck. And we know that the most common spot to get a disc bulge is at C5-6 or C6-7. So right where the bottom of that curve is. If you're sleeping, you want to make sure your pillow is not too high, because again, if it's too high, it's causing that sustained neck flexion. So it might be more comfortable for you to sleep on your side, or just make sure your pillow is not too high. We can take some of that strain off of the nerve. Like if you're finding that when you are sitting, you can't let that arm hang down, that's because that nerve is getting stretched. So you can prop up your arm when you're sitting at your computer or when you're driving or on the couch with a pillow or something, just to take some of the strain off of that. From a treatment perspective, laser can be really good at calming down the nervous system. We would be focusing on opening up the upper back and shoulders so that you can have your neck in a more stacked position, because when we're tight through the upper back and shoulders, then the head goes forward. We are going to use likely instrument only adjusting to minimize any further irritation. So we might be using the impulse tool to try and get the bones of the neck moving a little bit better and working on some of those tight muscles. We're also going to prescribe you some home exercises for you to do. And I've done a whole video about exercises for cervical disc herniations. The most important thing we want to do is reestablish a better posture with an open chest, shoulders back, and the head stacked, so we're not putting strain on the neck. So that's going to come with things that you do at home and things we can do for you here in the office. Of course, all of these symptoms can also mimic other things like carpal tunnel syndrome or a rotator cuff injury or a problem with the ribs in the spine. So it's important that you get a proper assessment to really determine the source of your pain. You can book online with us for that assessment at willowbrookchiropractic.com. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.